hitting the red button.
Ready?
I hit the green.
All right, we're
You're live.
Live, okay. We will call the May 23rd, 2023 Board of Public Works and Health, not Board of Public Works, sorry, that was this morning. Board of Public Health to order. Today I think is more of a general discussion. I don't believe we have any specific agenda items to vote on. Is that correct, Monica?
Not exactly a vote on, we have one for input.
Okay, great. But obviously, we have a lot to discuss post the legislative session on kind of, now that the fog is cleared, and I know Chris is here too, and he's done his homework on a lot of the legislative items that would have directly impacted us, and still do to some extent, but we're gonna walk through that and then talk about kind of next steps. Also kind of a post-mortem of our strategic planning meeting and kind of where we go from there. Is that right?
Yeah, generally, and then I have two quick demos.
Oh, excellent, all right.
Yeah. Okay.
Well, let's get started.
Well, easy. Okay.
So the first thing I just wanted to go over is, we're not gonna do the full updates of what we do as a health department. I think we've been doing this for a couple of years, and if you guys have the
We're clear, yep.
what that looks like, and I send you monthly updates on those. So if you have any feedback or something else you'd like us to include on those monthly updates, happy to do it. We are required to send those monthly updates. We also put them through council. So this is just kind of for your awareness that they show up on our council agenda as a monthly report as well. So they're definitely in the public record for anyone, if anybody's asking you about that. We're recording this meeting. I think you guys are aware of that. That's the general plan unless somebody tells me otherwise. As far as meeting times and locations, I just sort of wanted to briefly touch on this because I know we've got the next couple of meetings for the rest of the year scheduled. They're both on Tuesdays at 11. Dr. Lane can't make that time, so I kind of just, while we're here, if there's any other time on specifically a Thursday or Friday that might work for most of the board, that would be helpful for getting her here.
So Thursdays and Fridays are better for her?
Thursdays and Fridays are best for her. Those are her administrative days, all the rest are clinical days.
I think instead of trying to do that exercise here, perhaps we could just have Carrie or Carrie, when you're done talking to legal counsel there. If we need to move this, because we have a book for Tuesday.
Oh, I can send another email out and ask.
Because I know everyone's really busy, so it'd probably be better to just,
But if you have input to give Carrie directly while you're here, if that's easier, then we can take that into consideration too.
Okay.
I just wanted to kind of put that out there. So that
One of my pet peeves is watching a group of people try to schedule a meeting.
I don't want to do that right in the middle of this. I just wanted to throw it out here.
Especially probably this current.
Yeah, that wouldn't be good. All right.
Opportunities for involvement, if you really want to be involved in strategic planning or have some more in-depth involvement, just let me know. If you want to work at a farmer's market, we can find a spot for you. You've got your work t-shirts already. So if that's something that you're interested in doing, just let me know, and happy to get you more involved. And the last bullet was what I already covered with just the program update. Oh, so I don't want to go through the whole health department updates and things. I think those are well covered in the monthly meetings, but it is pretty typical for boards of health to get a program update. So my hope is that going forward, we'll have a brief update from one of our program areas, from one of our staff, so you can kind of get a little bit deeper sense of what it is that they're working on, what they're doing. As far as updates go, does that sound cool?
Sure.
Great. So May 1st, we rolled out Credible Mind, which you guys approved a couple of months ago. This is our mental health platform. This is generally what it looks like. So I thought I would just give you a quick demo if you haven't had a chance to look at it. The QR code is on the back of the t-shirt. We have had over 1,000 people log on since May 1st, and it'll take a second to pull up, I think, from the PowerPoint. So this is, what it looks like. You can search for different topics if you're interested in anxiety, depression, whatever you're interested in. You can do these assessments. So we've had a promotion running for a mental health check-in. Anybody that took that was entered into a $100 Amazon gift card drawing. So they've already mailed that out. I don't know who it went to. I don't get that information, but we had several hundred people take that. So that was pretty cool. We have community resources in here. They change the topics every month. We have the opportunity to include local resources. So this Psychology Today is a therapist finder tool set to Fishers. There's a variety of different tools and things. This is all, again, evidence-based like we talked about, but I wanted you guys to just get a look at it really quickly. The need help now is mostly the national lines. So if you were to take an assessment and be triaged kind of at the high need level, it would direct you to these resources. And it was like you need some more help than what these tools are going to offer. When you call one of these numbers, 988, of course, being the main number, and then we can modify what the local resources are. So we have specified which ones should be on those crisis pages. And then we can target additional resources on each other page. So we've got a general community resources page, but we can specify on each website which resources we want to highlight. So that will be a continual work in progress, but but we've got lots of resources on there right now, and we're already seeing people use them in the police department, fire department. So we've been rolling it out to all our staff so that if people are needing help, that they have that resource easily available. So the other thing I kind of wanted to show is on this is the admin portal. So this is where we can add our local resources, but this is also where the reporting is. So one of the great things about this particular platform is that we get reports back on how people are using the platform, what assessments they're taking, and what kind of things they're interested in. Set it, and we can set it for any date range, which is pretty cool. So all of these things along the left-hand side are different types of reports that we can get and that we can drum up at the time. You can see May 11th. I don't know what went out on May 11th, but something big went out on May 11th, and a lot of people took the assessments on that date. But you can see we have over 1,000 users. People have the option. We have, let's see, 118 registered users. So I'm a registered user. I have my name up there. They have the option to do this anonymously, and that's what most people are doing. But if they register, then they can save articles and that kind of thing. We don't have any identifiable data or anything that we have access to, but we can see what types of assessments they're doing and what the results of those assessments are in aggregate form. A lot of people have taken the Are Your Off Days a Sign of Depression assessment, and a lot of people have looked into information on anxiety and youth. So it's just kind of interesting to start seeing some of that data coming together on what we've been putting out there. So depression, symptoms here, our users, here's that they break down severe symptoms, 32%. And compared to similar Credible Mind users, I'm not 100% sure if that's all Credible Mind or if that's if they're bucketing it somehow. I suspect at this point it's probably all of Credible Mind, but here's ours and here's similar users. So not terribly different on the severe symptoms, but I think we have a few more of like some level of symptoms than that. So again, just giving you a broad overview of the kind of reporting that we get from this, and it's something cool to see on the data. Any questions about that or anything you guys want to look at more on this? No?
Well, I think it's a good step forward. So when we created our mental health initiative, we had built our own website, but one of the challenges we had was maintaining relevant content
Mm-hmm.
and then having an engagement platform that actually worked for people who are in need. And so leveraging the assets of this particular vendor to be able to always have peer-reviewed content, then the back-end data analytics is far more than we ever had. So the one big question mark we had when we were looking at this is whether we had a search engine optimization plan that would allow people, because if my son's having anxiety, I'm going to Google, anxiety, child, Fishers, what have you. Does this come up as a resource? And I think you work with communications to ensure that they did have those.
We do. So as part of the rollout, they did purchase on our behalf Google ads, specifically targeting this geo space, and when people search anxiety or depression. So we can see here on the traffic source, like how many of those
Yeah.
have come from that Google paid ads. We see that has generated 383,
I think that's something we'll
Drive
just
to the
wanna
website.
continue to try to feed so that we're top of mind when
So
people
they
are.
only pay for it for the first month, but, you know, this is the data that we'll use to say, okay, is this something we want to continue to pay for? And they say that a lot of
Effective.
users continue to pay for that because those Google ads are helpful.
Do you foresee that Google, ads being our number one traffic source? Because direct email probably has a ceiling.
Yes, I think, you know, the direct email, that's really because we push this out really
Right.
hard on all the city channels, for the month of May.
Mm-hmm.
Yes, maybe, but we're gonna continue to have it on,
I think you're gonna
we're
have
gonna
to,
continue to have it
refund it.
sprinkled on social media, but I do think
Mhm.
we're gonna have to continue to pay for Google ads.
I agree.
I agree.
Okay.
But we have a whole plan over the course of the summer to really keep rolling this out with businesses. You know, we've thought about like, okay, one of the reasons you guys have coasters in your bags is because we're thinking, okay, like probably bars, like would be a good place to reach people, like that may, you know, that may.
Is it
A
integrated?
bartender may feel ill-equipped to say.
Do you think?
Yeah, here's the coaster. Yeah. Stand this out. What about the,
With a decal
Yeah.
on the window. Like,
you have it integrated with the schools?
That's what I was gonna ask. Yeah, the
Schools?
schools.
Yeah, so Brooke was, planning to put it on the school website, on their mental health resources website, and she had sent it out, I think, through some
Okay.
channel that she had through the school.
Okay.
So continuing to work through some of those channels.
Right.
Because it has content, right, for,
It's all content, yeah.
yeah.
And we
for
have, we also work with the kids in the Bring Change to Mind Club. So, May 13th, at the farmer's market, they hosted, and we supported them in hosting a, Hope for Happiness event that they do annually. And so we have that website on the back of all the T-shirts that they had for the event. We'll continue to work all of those channels and continue to push this. And we actually have a summer intern, dedicated to this particular activity to us continuing to roll this out. So far, he's been really great at, really like kind of thinking strategically. I think he's developing some, like bookmarks to put in the library and like all sorts of, little tools and things to just kind of sprinkle around, so.
Is there anything targeted more towards like, youth activities, you know, youth sports or music or dance, things that are intrinsically just high stress, you know, something that might stress a kid out? So like maybe coaching or youth sports or music or dance or whatever it is the kids get involved in?
Part of the rollout plan and process. Concurrently, we also have a new social worker that started, and I have a slide on this at the end, that she's primarily supporting, you know, some of our public safety and our, integrated health program. But she's already started to get requests. She's a certified, youth mental health first aid trainer. So she's had requests to just speak at softball groups and to, you know, come to this youth mental health first aid training and things like that. So I think we may see little pieces of that sprinkling out too, because people are looking for stuff, especially, in that kind of sphere. Mhm.
Targeting, I'm sorry,
Go ahead.
targeting certain professions too. I mean,
And that-
veterinary
yeah.
medicine is huge.
Yeah, I bet you guys see a lot. That's a really good point. So, if
I don't know about the
Yeah.
medical field
Oh,
as
yeah.
well,
Yeah.
you know.
medical, definitely.
Yeah.
Chris.
Definitely. But the opportunities are endless. Like, we're definitely like a small team, so, but yes, we're hoping to get to the pediatrician's offices, to the adults.
Well, the good news is this is a scalable tool, right?
Right.
As long as you can
Yeah.
get it in the hands of someone, as many people that wanna use it can use it, so.
We pay for it based on our population size,
Yeah,
but there's no restriction on who can use it.
so you can
Like,
get on it.
Like, we don't have any borders on it.
Right.
So, I mean, we can see who's using it. I mean, there's lots of people in Indianapolis using it, in Noblesville. I mean, the
I was
word is
gonna say,
kind of getting
yeah.
out there, so it's really the tool that's useful for anybody.
When you're talking about intern, I assume you're talking about Elijah.
Uh-huh.
He's worth mentioning, I just,
Yep. Yeah, we have 3 summer interns, so I'll talk about both. Elijah specifically
Oh,
has
you're
half
talking
with mental
about-
health.
okay.
And this particular project we're rolling this out for the summer.
he's awesome.
He has been fantastic.
All right, moving on.
Okay. So here's the other demo I have. This is the food inspection.
Oh,
training.
yeah, much anticipated.
So you can see how the numbers have broken down so far, and this is not yet live. I'm looking for last minute feedback, if you guys have any additional feedback before this goes live. But I think it's in a good spot, and that's what I've heard from the people that I've sent it out to. We sent it to our team, we sent it to some of the leadership, of the city, just for any additional feedback. Let's see if I can open this right inside of the PowerPoint.
This would be on the health department's webpage?
Yes.
basically?
And,
Yeah,
and then eventually they'll put them in the
Windows?
windows, right? But not right now.
yeah, so by
The
September 30th,
astronaut.
they have to go in the windows,
Oh,
okay? Because we wanted to have all the inspections
Yeah,
done.
that's right,
And then
okay.
just, they have them all go in at the same time. So right now, this is password protected, based on city login, but this will, as soon as we're ready, we'll unpassword protect it. But I think we're essentially ready. So you can see the map and where the grades are. If you want to know what this particular item is representing, you can see that this is a sushi place. You can't, apparently they can't program it where you click on this Ace Sushi thing and it opens up their report. But if you find something over here that you want to explore, let's find some 1933 Lounge.
There we go.
Like that one.
Never been there before.
Right.
Oh.
So it shows
They
up
are.
your whole entire
Yeah, it is,
permit
yeah.
record on the right.
Oh,
okay?
really? So you can see the
So
history?
you see the whole
Oh.
permit record, our application and everything. So this is the system that we use for the inspection. And then you have to scroll all the way down. But then you can see, they have, this one still needs a final. This is sometimes where we find that we need to final stuff out. But we go through a process for QA where we have a conditional inspection issued, and then they just double check the scores a couple days later and then issue the final inspection report. But you can see they got an A. You can see all the things that they're measuring. So they basically rate everything as in compliance or not observed or not in compliance. There some different types of inspections, they won't have an observation because depending on the risk of the type of facility, they won't necessarily need that particular item. But if you remember, it starts with a score of 100 and then it gets deducted from there.
So is your intent to roll this out at the same time as the
No, our
signs go in the
intent is
window?
to do this too,
Oh, really?
like-
Okay.
now,
Oh,
essentially.
Oh, so we'll be able to see it. Like,
Yeah.
we'll be able to go online and,
Gotcha.
Yeah, I don't think a lot of people are gonna know it until they start seeing the guys in the
Right.
window.
yeah.
But yeah, if you want, if you want the
Really curious about
information,
the app.
you could do that.
You're including a QR code on the grading placard?
So you want to go look at,
Yes,
Oh,
yeah, we
yeah.
haven't finished the placard design, we have a meeting set for that in about a month, because we've got until September for the actual placard design, but we've been collecting, placard designs from around, the country. So yeah, I think QR code makes a lot of sense as
Yeah.
far as getting the inspection report. One of the criticisms of having a grading system, from food people is that then you don't, see the specific inspection items, and they feel like it simplifies it too much. Of course, the benefit is that it simplifies it
Right.
for the average user who doesn't want to
Yeah.
look at the full inspection, but either way, you've got that option, and we know that food grades improve practice, so. We've already had our first request for a reinspection with the fee, to, have a hope that you get a reinspection with a better grade, and, we've had those.
well, I know it was a heavy lift for you guys, so this is exciting to see that's
Yeah,
gonna be
it's
done.
great.
What all does this apply to, just brick and mortar? Is this like food trucks as well, or is this anyone serving
So,
food, or what all,
Yeah,
what's the
you
applicable?
can filter, at the top here, you can filter for permanent food establishments only. You can filter for temporary food establishments, for
Oh,
food truck
food truck
permits. If we hit all, and you can see as you zoom out, the numbers get more, so you have to kind of be zoomed in on the right areas.
Oh, and then there's food.
You can see how many of our permits are temporary versus food truck versus permanent. We're just now getting into food truck and temporary season, so.
Oh, okay.
we haven't got through all of
Farmers
those yet.
market.
But they're definitely on track, I think, to finish the permanent ones by September 30th, and we have quite a few, all the Bs and Cs, we said we would inspect more than once in a year, and we've had a handful of those, not a ton, but enough that, we'll keep us busy for the rest of the year.
Can they request reinspection? So like the Bs and Cs, can
So
they?
the Bs and Cs, what we had said on the ordinance that got passed was, that they could request an additional inspection once in the year with the opportunity to improve their grade by one letter only. So even if they went from a C-level inspection and they got 100% on their re-inspection, they could still only achieve a B
Okay,
for that,
for that, for the rest of the year.
Yeah.
Like, okay,
Mhm.
okay. Interesting.
Well, I appreciate your guys'
This is
work on this,
Yeah.
and
Very
look forward to rolling it out. And I know that BSG and whoever else, GIS, I assume was involved in this too, so appreciate all that
And
work.
we have still a little bit of troubleshooting to do, I would say, on the, where did my,
There you go.
here we go. We still have a little bit of troubleshooting to do on how we're gonna transfer this next year, because just from a programming perspective and a permit renewal perspective, so we've got all our meetings set up to make sure that we get that sorted out in time, but we wanted to get the dashboard up first. And then get the coding for next year kind of hammered out well before next year. Pretty cool.
Yeah, very-
I think people will like it.
yeah.
So just a quick update on what we said our goals were for this year and where we're at with those. Community health assessment is in progress still. We should be nearing the end of the heavy data analysis period. That is all part of the accreditation readiness, so there are a lot of pieces for public health accreditation, and we're trying to, as we build our program and continue to build, put things in place that will make us more ready for that. So I still have that as a goal. We had talked about designing an outreach program, like Cadets for Youth, so we have that. We have, our class determined, we have the application process, we got applicants, and we have the time, the space all settled. It's the Teen Public Health Academy. It's going to be at Riverside Junior High over the summer, and we've got a class of about 15 high school students
great.
That's
that
cool.
will join
Yeah.
us. And I think the program that we have set up will be pretty fun, very hands-on, with a variety of involvement and input from different programs. For example, Ashley from the fire department is going to be doing a hands-only CPR. We're going to do some QPR, mental health first aid training, and then we'll do some Narcan training. It's like, so a lot of like hands-on stuff. They'll get to like sort through mosquitoes on the water and do some water sampling.
You get to vaccinate anyone?
We're going to do a
No vaccinations?
We're not giving any vaccines.
Okay, are you gonna let them give any vaccinations?
No.
No. Sorry.
We are going to do a little restaurant.
I'm a junior vaccinator.
We're going to do a restaurant
Take a
in
shot.
Riverside, so that'll be fun.
Oh, yeah.
Restaurant
Yeah,
inspections.
there you go.
Oh,
So
cool.
lots and lots of like this broad-based hands-on
Yeah.
activities, so I think it'll be fun.
Good, how long is the course?
It's 1 week, half day.
Oh,
1 week
that's
from 9 to
awesome.
1. Yeah.
Okay.
So we'll see how it goes. We'll get the feedback and then we'll retool and readjust for next year. But
Yeah.
I think the kids
That'd be
kind
fun.
of got what it was about. We're pretty excited about it.
Nice.
Yeah. And then key interventions to decrease mental health needs of youth. So Credible Mind is the first step in that. So I think we're moving along that and continuing to push some of those things out, working with the schools and then our mental health action team. Communication channels with key partners. So we're trying to develop some newsletters. We just started our first mental health newsletter for the month of May that was sent out just specifically on mental health stuff. My goal is to have one for providers that has just specific like data points for fishers. Here's what we're seeing, like stuff like that. So those are examples of what those active communication channels look like. And then really working towards that culture of health and promoting a health and all policies approach. So our mental health action teams really are our best kind of springboard for that because we're involving the whole city basically in some of those teams that we're doing right now focused on mental health, but really that's the framework we need to use for pretty much everything. So I think we're all very excited about how those are going. So I know I said I wasn't going to give too many updates, so sorry about that. Trying to be
A lot going on.
It is?
So one question that came up, so this is kind of a policy question. I can tell you what our current policy says, but this has come up recently with some restaurants that we've had some trouble with is like, how many closures exactly or failures should we allow before we revoke a permit, maybe for the remainder of the year? So I'm kind of posing this question for you guys. Yeah.
What do our neighbors do?
What do our neighbors do? That's a good question that I don't know the answer to. So we can certainly gather that information. This came up pretty much yesterday. So
Under Indiana law, Chris, is there any restrictions on the ability to pull a permit?
So we have a process in place. Right now, our code suggests that if you're going to do it, you have to provide notice in the public hearing before you revoke it. Because it is a property right in a sense, and before you take that right away, you gotta come out, you shut down a restaurant for X period of days. They pay the reinspection fee, the mandatory reinspection fee for failing. They get it right for maybe 2 to 3 weeks, and then you're back out there again with the same problem. So if there's a successive pattern of an unwillingness to follow kind of your mitigation strategies or to follow just the basic standards that are put forth, then at what point, would you want to bring them in? I think right now, it's good to have this policy question to kind of gauge it to the department, if we want to take that strategy going forward. I think if we run into this problem more frequently, I would like to take a shot at amending the ordinance to put some more language around factors that we could utilize. Monica's got a lot of discretion in this based on her health director's role, which is the way it should be. The courts don't look at that favorably because now you've got unfettered discretion in determining who can operate a business or not. So we would say, as long as Monica came forward with a lot of evidence that practices weren't being adhered to, and had a substantial risk for the general health of the public, then we'd have that opportunity. But it would be a semi-formal public hearing process that we would move forward, and it would only be for that year. So, you would take the opportunity to remove somebody's permit for that year, but there's nothing that would prevent or prohibit that business owner from coming back and trying to get a new permit for successive.
I mean, other than the fact that they're out of business
That's correct.
I mean, they're not generating revenue
That's
for
right.
Right, which maybe
extended
they
period of time.
can't,
Yeah, I mean.
they can't, yeah.
So Chris, this is a consistency question.
Right. Yeah.
So, and this is shot in the dark, would the public safety nuisance ordinance be a tool or something similar, only adapted to public health? Because after you failed so many times, the
Yeah,
same type of.
Certainly, I think that's
It
what
could
we're,
be a model,
I
right?
think
Yeah.
that's what we're looking at.
Okay.
If there's a successive failure provision. Right now,
And make it consistent?
it's more generalized to say, when it's a significant public health concern because of these issues, then we can take this action.
So if you're going out inspecting, it fails, you get a reinspection fee, you go out and pass, how are your folks going back out there 2 weeks later, or 3 weeks later? Are they just
They're
taking it upon themselves to be
They're not
proactive?
typically going out
Is it
that
complaint driven or?
So typically, it's not that tight of a time frame. Typically, what happens in the current examples that we have is we went out for the regular inspection and they failed. And so they are told what they need to do to get back to reopening the critical failures that make it unsafe for the public. And when they feel like they're ready, and sometimes it's an easy fix, sometimes it's not an easy fix, when they feel like they're ready, then we go out and reinspect them to allow them to open. Under our current policy, it allows for one reinspection, whether they're closed or not. It allows for one reinspection to be included in the price of the original permit. So people have stuff all the time that we have to say, okay, you need to work on these things. We're gonna come back and just check. And sometimes we close them for those things and sometimes we don't, but we try to get back and check. If it's more than that, if it's successive re-inspections, that's where we charge, I think it's 50% of the permit fee for that inspection. And then the way that the policy is currently written from what we had approved last year is that if you're a B, you can be expecting at least 2 full inspections a year on a regular.
Okay.
And if you're a C, you can expect 3 to 4 inspections per year, and we will charge you for each of those
See.
inspections. So there's definitely a disincentive to having the lower grade in the first place. So that's kind of where we're at on those things. It's not quite.
Well, I would have a, like,
We haven't been recording for a while, I just realized that,
No worries.
life goes on.
Yeah.
That will adjourn.
Any question, thoughts, or concerns for Monica? Great outline.
Great outline. Happy to help more.
Yeah, motion.
You did, you're.
Motion to adjourn?
Motion to adjourn.
Second.
All in favor?
You were like, no, you